Hattiesburg. Thanks for joining us for this COVID-19 briefing for Wednesday, July 22nd. Today's numbers, these are all of our healthcare organizations, Forest General, Merit Health Wesley, Hattiesburg Clinic, Semri, and the Moffitt Health Center at USM. As of today, 33,809 tests have been conducted. 3,574 of those have come back positive. Of course, those are not all in Forest and Lamar counties, and they're not all active cases. 28,445 are negative. We have 1,792 tests which are pending as of now. In the hospital today, between Merit Health Wesley and Forest General, we have 84 patients who are COVID positive in our hospitals. That's a new high for us. That's 14 over the average for the last 14 days. We have 22 patients who are under investigation for COVID as well. Of those patients, 34 are in the ICU. That's 4 over the past 2 weeks. You can see how this lays out for the past couple of weeks, and we continue to add new lines to this graph to account for all of the new people who are winding up in the hospital. And so I'll go over 80 for the first time today. We also see our ICU admissions getting close to 40, coming down just slightly. But again, this is not great news for us. Of those 34 in the ICU, just to know where they're coming from, 23 of those are on ventilators right now. They come from 13 different counties. However, 10 of those 34 are from Forest County. The average age is a little under 60. Lamar County did report 1 new death yesterday. That brings their total to 9. We've seen 5 deaths between Forest and Lamar counties in the past, actually 8 days. And in terms of new positive cases, Forest County stands at 35 right now. Lamar County is at 13, which brings our metro area total just for today to 48. Totals as of now, 1,267 in Forest County, 845 in Lamar County, over 2,100 now in the metro area. Kind of see how this lays out in a 5-day average. Of course, we had that data reconciliation day on Saturday, so we're still sort of getting the effects of that. However, the 5-day average kind of smooths that graph out where you can kind of see where trends are headed. And so Lamar County still under 30 new cases per day. Forest County just over 20. However, Forest County, notice, has had 2 days in a row where they've been at 35, so that their 5-day average is trending upward as well. Inside the past 14 days, this is where we look at the number of new positives reported in the last 2 weeks, because this disease cycle typically is around 14 days or fewer. And so the people who have reported a positive test result in the past 14 days, it's typically a general idea, not exact by any stretch of the imagination, but a general idea of how many active cases you may have in your community as of now. So in Forest County, that number is 340. Again, we added a 35 today, so again, 340. In Forest County, Lamar slightly higher at 345. This is where that lays out on the graph. The blue line is Forest County, the orange line is Lamar, the gray line are the 2 lines combined. So we're getting very close to having 700 potentially active cases in our 2 counties. We give you this information so that you can act on it and make hopefully wise decisions, because we want to protect vulnerable populations, people over the age of 60, people with underlying or chronic health conditions. We also want to prevent overrun of the healthcare system by slowing the spread. We'll talk about that in just a second. And prioritize public health while giving the private sector the space it needs to operate. So it's safe to say we are not accomplishing goal number 2. We are not accomplishing the goal of preventing overrun of the healthcare system right now. And I know it's not just Forest and Lamar counties, because the whole Pine Belt comes to Hattiesburg at some point for their healthcare. However, both hospitals, Merit Health Wesley and Forest General, are now beyond their initial ICU capacity. We had stakeholder meetings that we do weekly with both our hospitals and our clinics and our emergency managements and our universities and schools, and this was the message today, is both hospitals are now beyond their initial ICU capacity. That's been that way for the last several days. Both hospitals are now in their surge plan for their ICUs. For example, Merit Health Wesley has 18 ICU beds on a regular basis. They are now beyond that in terms of ICU patients. Both Forest General usually has 48 ICU beds. They are now well beyond that, because you have to keep in mind that in addition to the COVID-19 patients, they're still seeing their regular load of strokes, heart attacks, car accidents. Both Governor Reeves and Dr. Dobbs spoke to this today. We'll talk about that in a second. The issue right now for their capacity is not space, it's not beds, it's not ventilators, it's having enough nurses and having enough hospital personnel to help take care of very resource-intensive patients. At one of our facilities, it was said that a nurse can typically take care and manage 5 to 6 patients on a regular hospital floor. When there are COVID-19 patients on a regular hospital floor, that falls to 3 or 4 patients max per nurse. When you're talking about COVID-19 patients in the ICU, that's 1 or 2, given the amount of personal protective equipment, given the amount of just how resource intensive those patients are. And so even though you may have space in beds, you don't have enough personnel to try and take care of all those patients because, again, each COVID-19 patient in the ICU requires such a high degree of care. That's why we're beyond our capacity, and both hospitals are in their surge plans now in terms of intensive care units. Again, going back to the goals, the way we correct number 2 over under the healthcare system is by accomplishing number 1, which is protecting vulnerable populations. If you are over the age of 60, if you have a chronic health condition, you really need to be wearing a mask, and you really at this point need to just be staying home and avoiding contact with folks who could have been exposed and could be bringing that back. Remember the stat we showed you last Friday that in Forest County and now really Lamar County, if you're in a crowd of people of 50, there's over a 90% chance that one of those people has COVID. And so even if there's a group of 10 people, there's a 35% chance that somebody in there is COVID positive. So protect vulnerable populations, which will help us prevent overrun of the healthcare system, which will allow the private sector to continue operating. 4 factors we look at: widespread availability of testing, wearing of masks, which we preach about all the time, watching our own data, listening to all voices. Some statewide data we want to share with you today: 1,547 new cases, 34 new deaths. Again, that's a relatively high number for Mississippi. And one thing that Dr. Dobbs reported on today was that 40% of all ICU patients in Mississippi are now COVID-19 patients, which again lends itself to talking about how a lot of hospitals are at their capacity and they've activated their surge plans. If you need a mask, both our emergency operations centers, Forest County and Lamar County, have them for you. Forest County is located at 4080 US Highway 11. If you are elderly or if you are disabled or shut in, they will deliver one to your home. You call 544-5911. It's 544-5911. If you're in Lamar County and you need a mask, you can go to 197 Central Industrial Row in Purvis. If you are disabled or you are elderly or shut in, they will deliver one to you as well at 794-5378, 794-5378 for a mask. In our Act of Courage today, of course, we started the Mask Up campaign. I want to thank Dr. Rodney Bennett, president of the University of Southern Mississippi, who tweeted this picture to his followers. Again, hashtag Mask Up Hburg, as well as hashtag To the Top Together. This is important. We are asking our community leaders to lead by example, our business leaders to lead by example. We are asking you to lead by example by adding the Mask Up Hburg hashtag graphic to your Facebook profile, and then just to wear a mask. That's why if we lead by example, we can turn this curve around and start trending downward. As we go into the rest of the week, remember to wash your hands, take care of yourself, wear a mask if you're out in public, do only what is essential, and remember right now you are safer at home.